And because the smaller you are, the faster the heart beats. The bigger you are, the slower the heart beats. So a hummingbird has a heartbeat of 600 beats a minute. It's like super fast. This little teeny heart is going. And it sounds like that too. It sounds like. Whereas an elephant's heart is like. It's like one time a minute. No, not one time a minute. But it's just so slow. And there's a lot more of it to beat, a lot more blood to push out. Whereas the hummingbird's heart.
Hello, everyone. Welcome to the Healthy Heart webinar. I'm getting this shared here on Facebook for all of you viewers on YouTube, Facebook, and I don't know, anywhere else you may be seeing us. Who knows? I mean, we've been doing this for a while, and I think we have viewers from all over. And so who knows where you're seeing this?
We've had people from New Zealand and Ecuador and Holland, and like, wow, we get them from all over the world, literally.
I know. And the fun thing is people are setting their alarms to get up in the middle of the night to watch these webinars. And so that is just a testament to Dr. Saunders' teaching, seriously, because you cannot.
So a year ago, I would have said, get a life, but I guess,
But you can't get this kind of information or question and answer.
It's true. It's true. My mom is, she's only in Idaho, and she calls me all the time. She's with her healthcare woes. She's like, oh my gosh, I went in to see the doctor and I saw the nurse practitioner. Nurse practitioner said, I don't know, you'll have to see the doctor. Well, that's what I made the appointment for. And she's just going back and forth, and she gets pushed around, and they said, no, we're not going to prescribe medications because you're over 85 and you can't get medications anymore. What? You just die when you're 85? What? It's like, they're crazy.
Seriously, though, it's just such so much value in this. And of course, there are other doctors out there who are phenomenal as well.
Yes, there are.
And
I know some of them.
Yeah. And, I hope that they are doing something similar, but I haven't found anybody else who really is that's doing it for free. So this is
free. You get what you pay for.
This is something that is just really special. So we love that you guys can hop on. We have Dr. Saunders teach, and then he opens it up and we get to ask him questions. We try to stick to the topic, but as you know, it doesn't always happen. But we just love it. So twice a week, Dr. Saunders hops on to do these webinars. Yesterday, we did our webinar, the Fixed Blood Sugar webinar. And today, of course, is our Healthy Heart webinar. So we are excited that you guys are here. I know many of you are on both of those, and I just love it. We are getting emails from people talking about how their health has improved so much because of the things that they have learned on these webinars and from these solution kits. So today's the Healthy Heart, but we also do our Fixed Blood Sugar webinar where oh boy, there we go. Apparently I can't hold two, where we do the diabetes solution kit. We kind of go over this, two really awesome opportunities to learn about your body in a way that isn't outdated. How about that? I feel like everything that I typically would find or learn was information that was 20 years old. And Dr. Saunders spends his time. Actually, I don't know when you sleep.
Most people don't know that. Most people don't know that the science is at least 20 years ahead of medical practice, that it takes like 20 years. So 20 years ago, the science started saying, oh my gosh, bacteria in your intestines are really, really important. And only now are we starting to see the regular medical doctors saying, you should take a probiotic. Yeah, I actually had somebody come back from the hospital on an antibiotic and was given a probiotic as well. So, that's 20-year-old information is finally starting to get into practice. And that's pretty much always across the board. Everything that you get from your doctor is 20 years old.
Little side note about me, I was diagnosed with Crohn's disease in 2004. I was in college. Actually, it might've been 2003. But anyway, I remember going to my GI doctor, and he was a great guy. he had told me that food would not make a difference. Never mentioned probiotics, said I could eat whatever I wanted. And it was funny because I reached out to some people more in the natural space who gave me a completely different view of what he had said. And I don't know. I think if anything in these webinars, we've really learned, first of all, we love Dr. Saunders, but it's important to take your health in your own hands and seek out options or seek out information. Not that one person or practice is wrong, but there are options. Let's just say that. So we love that. We've loved that we have learned that. So we encourage you guys to do that too. And we talk about this a lot too. For example, those of you who hop on our diabetes webinar, Dr. Saunders will tell you this is not the only way to reverse your type 2. There are other ways, but this way is the way that we put together. It might be the easiest way for the most people. You know, there are other options. So it's just now more than ever, when information is available at your fingertips, I think you got to take advantage of it. So here we go. Today, we are going to be talking about our healthy heart. And I'm excited about this because this is going to be a quick little, this is like my challenge for Dr. Saunders, because I sprung this on him last minute. I changed our plan. And I have found 7 common signs associated with a healthy heart. And we're going to quiz Dr. Saunders. No, we're not. I'm actually going to read through these with him. And I want to get his opinion on these, because a lot of us are thinking, maybe you're on this webinar, you're thinking, you know what, I'm pretty sure my heart is healthy, or you've never thought about it before. Some of you have heart disease. Some of you just want to prevent it. So we're going to dig into some of these things, see where you stand, see what's true, what you found in your practice, Dr. Saunders, and maybe some options to make sure that we don't go down the wrong path when trying to prevent heart disease. And so a quick disclaimer, Dr. Saunders is not your doctor. And so we just encourage you to discuss these things with your provider. Okay, so here we go. I'm going to start out. So these are the common signs that are associated with a healthy heart. And I actually pulled this from the Children's Center for Holistic Heart Health. So I don't really know that that means that this is just for children. I think this is just where it's coming from. It says the first one, you know, and I don't know how much we've talked about this, but it says a standard heart rate that ranges from 60 to 100 beats per minute. Is that considered in your mind a healthy heart rate?
Okay, that is very interesting. So the fact that this comes from a children's heart health website is going to tell us something about that. And because the smaller you are, the faster the heart beats. The bigger you are, the slower the heart beats. So what was that? A hummingbird has a heartbeat of 600 beats a minute. It's like super fast. This little teeny heart is going. And it sounds like that too. It sounds like. whereas an elephant's heart is like boom, 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 boom. It's like one time a minute. No, not one time a minute. But it's just so slow. There's a lot more of it to beat, a lot more blood to push out. Whereas the hummingbird's heart is, well, you know, human beings are the same. So when a child is first born and they have a heart rate of 120 a minute, wow, great, okay, that's good. Whereas if you have a full-grown adult with a heart rate of 120 minutes, like, nah, not good. That means you're tachycardic and there's some problem there. So knowing your heart rate is a variable that you have to think about why it is. So if somebody has a heart rate of 50 and you go, oh my gosh, that's bradycardia. Your heart rate's too slow. That maybe not. Ask them a few questions. Okay, when you stand up, do you get dizzy? No, I'm fine. Do you exercise a lot? Yeah, I run marathons. Oh, okay. So people who run marathons are going to have a heart rate of 50. And so even though it says 60 to 100, you could be even slower. You could be in the 40s if your resting heart rate could be in the 40s if you're like a performance athlete, for example. And that's okay. Kind of an average person is going to be in the 60s, 70s, 80s. And actually, if I see somebody who's like an otherwise normal adult in the 80s or 90s, I'll question it and say, why is your heart rate fast? Is there an issue with your heart? And the reason for that is there's something called ejection fraction. Ejection fraction is how much of the blood is being pushed out each time. So a 70% ejection fraction is great. That means 70% of the blood is being pushed out with each beat. A 20% ejection fraction is terrible. That means only 20% of the blood is being pushed out with each beat. Well, think about it. If you only have a 20% ejection fraction, how many times do you have to beat to get the same circulation? It's going to be going a lot faster to get the same amount of blood flow than somebody who has a 70% ejection fraction, right? So the speed, the rate of your heart might be important for finding out what problem you might have with your heart. People who are just not physically fit, well, they have the 50% ejection fraction. They're going to have a higher heart rate, resting heart rate than someone who's really physically fit. So, you have to weigh all of that in the balance and find out why. So if your resting heart rate is somewhere in the 60s or somewhere in the 70s, no issues. Probably somewhere in the 80s, no issues. When someone's in the 80s, generally I'll tell them to work out more, to start getting their heart rate up, do some cardio workouts. So yeah, heart rate's important. You didn't think that, huh?
So, but when you're saying heart rate, are we talking resting heart rate?
Yes.
Okay.
Yes, resting. In each case, that would be resting. Because in the case of exercise, you want it to get up to 160 beats a minute. You want it to be able to get up to a faster rate, because that gives more circulation, you get more oxygen, and at some point you reach a maximum. It levels out, and that's when they do cardiac stress tests, they push and push and push you until you reach that maximum. You're not gonna get a higher rate.
Okay, this is good. All right, another common sign associated with a healthy heart is if you have normal breathing, that tends to indicate your cardiovascular system is functioning normally. Any thoughts?
Yeah. I'll bet you didn't think of that either. People go, I can't breathe. I feel like there's an elephant sitting on my chest and I can't breathe. I can't take a deep breath. And that is a sign of a heart attack. So when your heart doesn't work well for other reasons. So with the COVID-19, they did a whole bunch of studies. Oh, I'm sorry, I said it again. That I said that terrible word.
We'll edit it out later.
Okay,
say the virus.
The virus. No, not the virus. It's actually the vax. Harvard did a study on the kids that were vaxxed. These are children. These are males, boys that were vaxxed. 150 of them that were vaxxed and had cardiomyopathy, and 150 of them that were vaccinated did not get cardiomyopathy. And they tested them for everything and found out that the ones that had the cardiomyopathy had persistent spike protein in their blood, which was doing damage to their arteries of their heart. And what was their symptom? Shortness of breath. So they're going, I can't breathe. And everybody says, oh, it must be your lungs. No, you know what? A lot of the time it's the heart. So cardiomyopathy is another reason. Congestive heart failure. The heart is failing. It's only beating, you're only getting a 20% ejection fraction. And people don't say, gee, I have chest pain, I have heart attack, my heart hurts. They go, I can't breathe. That's their only symptom. So what they're talking about here, normal breathing indicates your cardiovascular system is functioning normally. And that means like you go out and run and yeah, you're going to breathe hard, but some people they really can't breathe when they go out and they do some exercise and it's just over the top, can't breathe. And often that's a heart problem and not a lung problem.
Interesting. All right, this is good. Okay, another common sign associated with a healthy heart, This is a big one. I hear about this. Good oral health. What does that have to do with a healthy heart?
That is really interesting. Any kind of inflammation. So we've talked about this on the webinar before about inflammation doing damage. Why? Well, because inflammation causes or allows damage to happen in the blood vessels. And heart disease is blood vessel disease. And that's what it is. So if you have inflammation anywhere in your body, anything, if you have arthritis, if you have an infection, if you have a virus, or if you have periodontal disease. And yeah, there is a direct correlation with gum disease and heart disease. And a lot of people don't think about that, that it's a problem. A lot of doctors think that it's the bacteria specifically in the mouth that does it. The bacteria are related only because the bacteria that are causing the gum disease are causing inflammation generally. And that inflammation both wears away and causes damage to the blood vessels, but also prevents repair of the blood vessels. So that the process that goes on with inflammation causes or allows more heart disease to happen or more vascular disease to happen, which can affect the heart, of course. So it's not the bacteria, it's the inflammation. So brush your teeth, floss. That's actually really important.
Oh, my son is on this kick right now where he's been watching videos that talk about how people never used to brush their teeth and their teeth were way healthier back in the day. And I don't know where he's getting this information, but.
Well, no, it's true. You know what? People did not have healthy teeth in the old days. I mean, oh man, it was horrible. Tooth disease and gum disease was really bad and really rampant, and most people had it. However, if you go to areas of the world where they don't have any sugar, processed sugar, they have beautiful teeth into their way adulthood, and they don't brush or floss. There was Weston Price was a dentist who went around the world and was testing all of these people and looking and says, how come this group of people that doesn't have any, they don't have any tooth decay, they don't have any gum disease. He's a dentist, right? And he's looking for this stuff. He's looking in their mouths and going, wow, these guys have perfect teeth and they never brush, they never floss. So I mean, they're not totally wrong, but in our society, how are you going to avoid all of the junk and food and stuff that causes heart or gum disease?
Yeah, it's true. All right, here's another one. Now, we have touched on this quite often. We've talked about blood pressure. So a normal blood pressure indicates that your heart is in a healthy state. This research also said that hypertension may be linked with stroke or heart attack, and you need to undertake a healthy heart indication diagnostic test. First of all, what is that? What is this test?
The healthy heart indication diagnostic test. These are diagnostic tests both for blood tests to see if there's any damage to the heart, and to see if your aldosterone renin system are working properly because of the blood pressure's high. But also like an echocardiogram would be another indication of any damage, or electrocardiogram, EKG. Any of those might indicate that there's an issue with the heart. The issue of blood pressure is like, it's a really big issue because of this drug sales mainly. If it wasn't for drug sales, then doctors would look at blood pressure as an indicator, as a symptom instead of a problem. So right now it's looked at as a problem, whereas in reality it is a symptom. So if you look at someone's blood pressure, what does that indicate? Well, there are 300 different reasons why somebody might have elevated blood pressure, and some of them have to do with the heart. But others have to do with hormones. If you have adrenal problems, and there are several different adrenal problems that can cause elevated blood pressure. If you have kidney disease, various kinds of kidney disease, sometimes no kidney disease at all. Sometimes it's a blood vessel that's blocked going to the kidneys. If you have brain disease of many different kinds, multi-infarct dementia, if you have a lack of blood flow to the brain, having diabetes makes your blood pressure go up. Why? Because your brain isn't getting enough sugar, glucose. So since the brain doesn't have enough energy, the brain's going, hey, I need more blood here, and raises the blood pressure, because that's the only way the brain has of increasing its circulation. So all of these and couple hundred more reasons why the blood pressure can go up. So the blood pressure may indicate a heart problem, but it also can be a host of other problems. That's why it's so important to know why your blood pressure is elevated, and not just to take a drug for blood pressure.
Yes. All right, good stuff. And if you want to learn more about blood pressure, I really would encourage you to go back to one of our past webinars where we really dive into this. We talk numbers. We talk about the death rate U curve chart that Dr. Saunders brings up quite often, or graph.
The U curve.
U curve. Okay. But it's really important to learn these things. And so bartonwebinar.com, you'll find a link to our YouTube channel. Be sure to go to that and check out some of these webisode. That's good. Webisodes. I like that.
Hey, you just coined a new word.
Writing it down. Hold on. Webisodes. Okay.
You can take credit for that one.
I know, right? Okay. So check out our webisodes, and yes, we'll get a good education. Okay, back to our regularly scheduled program here. Some common signs associated with a healthy heart. All right, this is number 1, 2, 3, 4, 5 on our list. Healthy cholesterol levels. Let's talk about that.
Okay, so this is really interesting, because in a Children's Center for Holistic Heart Health, so this is for heart health for children. They say healthy cholesterol levels in your blood enhance cell production. Okay, that is so true, and especially a child that's growing is going to need a lot of cholesterol. However, high cholesterol.
I never hear that anywhere else.
Right, but they have that here, right?
Yeah.
So you need healthy cholesterol levels, and we've looked at healthy cholesterol levels, and the healthiest level, whether you're a child or an adult, is right around 220, 240, between 220 and 240, is where you want your cholesterol to be. So yes, healthy cholesterol levels enhance cell production, and that's what they do. So that is really important, because if you lower the cholesterol, then the death rate actually goes up. And if you go too high, the death rate goes up. So that's that U curve that Leslie was talking about a minute ago. You do have an optimum level, and that's between 220 and 250-ish.
And we have a webisode where we talked about that as well. So be sure to check that out. All right. Let's see. Another common sign associated with a healthy heart is the ability to regain your regular heart rate after rigorous exercise.
Okay. So if you guys have a watch, see my watch, it tells me so much info. I've only had mine for a couple of weeks. And in the last couple of weeks, I'm walking around staring at my watch all the time, all day long. Oh, look, this is my sleep. Oh, look what I did. Oh, I've done 2,337, 2,338. I'm watching it count up as I'm stepping.
That reminds me, because yesterday before we started the webinar, you were like, oh, this is how much deep sleep I got. I didn't even think about the fact that you were looking at your watch, though. That's funny.
I do that all the time. So, but one of the things that it tells you, because it keeps your heart rate, is your recovery after exercise. And so, so based on this, I started running again. I had quit running for a couple of years, like 3 years. No, not that long. But anyway, a couple of years. I had quit running. I hadn't run at all. And then I got the watch, and I'm going for a run. I want to see what it says. And it's really cool, because you get to 1 mile and it goes beep, beep, beep. 1 mile, your pace is 14 minutes. And I'm like, wow, that's pretty cool. So then, so I did a 14-minute mile the first time, and then I go, okay, I'm gonna beat it. So then the second time I did it, the second mile I did 12 minutes, and then the last mile I did 3 miles. The last mile I did in 11 minutes. So I beat my record. Anyway, one of the things it tells you after that is your recovery, your ability, how quickly you regain your regular heart rate. So you're running along and it gets up to 160 beats per minute, and then you stop. How fast do you recover from that? If it takes a couple of minutes, that's too long. It should be like within a minute, you should recover it. So your ability to regain your regular heartbeat, in other words, get down to a resting heart rate of, in the 60s or 70s, that's an important sign of how well your heart is functioning.
Oh, that's interesting. That's a lot faster than I would have guessed. Like a minute to recover.
Yeah.
Wow, I'll have to check mine. That's interesting. Okay. All right, guys, are you taking notes? This is a lot of good stuff. I'm enjoying this. All right. All right, we are on our final one here. Number 7, signs associated with a healthy heart. An active lifestyle shows that your heart is efficiently functioning, and your body cells get adequate nutrients and oxygen. So what is that really saying? How do you determine if you have an active lifestyle?
How many steps do you take? Let me see. I'm up to 238 steps today.
Okay, wait, you're 2 hours behind me, so that's acceptable.
Okay. Well, I don't go anywhere all day. I have to wait till after work, and then I get to walk around and do stuff, or run or whatever. Sometimes I'll do it in the morning. But anyway, the active lifestyle means you're doing stuff all day long and keeping on your feet. People who work on their feet, they do better than people who are sitting all day long at a computer in a cubicle. It is better to have an active lifestyle because exercise is really important. And so if you have an active lifestyle and you can manage like going up the stairs. So instead of, you see the elevator is going to get crowded, I'll just go up the stairs, and you take the stairs. And what if you get halfway up the stairs, you're like, remember breathing, it's not a problem with your lungs, it's a problem with your heart. So you're breathing hard, just getting halfway up the stairs. You know what? That's not, your active lifestyle is not showing a good heart function. So, and the other half of that, what it says is getting nutrients and oxygen out to the tissues. That's what the heart has to do. And if it's not doing that, then you start doing what's called anaerobic respiration, which is very inefficient. And so you need the oxygen, you need to get that circulation, and your heart has to do that.
Right. This is good. Genevieve is asking, what kind of watch do you have and where did you get it?
Oh, well, because I have a Samsung phone, I got a Samsung watch, and I got, so just so that you guys know, because you asked, I researched it a lot, and I had several other different kinds. I had a Fitbit, I had another one, but those were the early models. I wanted the upgraded model that had everything, and I wanted it to be accurate. So I was looking for accuracy. So I got the Samsung 5 Pro, the Galaxy 5 Pro, because it had a bigger battery life. And I'm not one to wait around for the battery to charge. And I want to wear it overnight, so I monitor my sleep. So so the longer battery life, it's really helpful. But also it has oxygen level. It tells me like at night, my oxygen gets down like into the low 90s, or I was 87 one time. Like, what the heck?
Interesting.
Stuff like that. Yeah, it gives a lot of information. I was pretty happy with it.
I actually just saw someone share information about how they didn't get very much oxygen at night. They showed that something in their airways was shrinking. Well, it must not have been in their airways. I don't really know, but it was preventing them from losing weight. Just the fact that they weren't getting enough oxygen at night. Thought that was kind of interesting.
Yeah. Okay. So there's a reason why it happens. If you're not getting enough oxygen, you make a whole bunch of adrenal hormones called cortisol, adrenaline. And when that happens, you get insulin resistant and you get higher insulin levels, and the insulin tells your body to put on more fat. So that's this chain of events that happens from a lack of sleep, causing a stress reaction, this whole stress reaction, because sleep is so important for preventing stress.
Yeah, so interesting. I hear a lot about heart rate variability. What do you know much about that?
Yes. Okay. So that's the other thing the watch does.
Yeah.
It tells you what your variability is. And that is a sign of an autonomic nervous system function. That's how it should function. So you should see variability. This is important when you're relaxed and quiet and not having any issues, then your heart gets relaxed too. And a relaxed heart will beat according to the need. So it'll between beats, it'll be milliseconds difference between beats. You wouldn't necessarily notice it if you were listening. It would sound like boom, 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 boom. So it would sound really regular, but because it's being measured electronically, the electronics can take milliseconds, thousandths of a second differences in those beats, and say, oh yeah, each one is a little bit different. That means your heart is beating according to the need, the immediate need. Whereas someone who is absolutely on every time, that's usually a heart that's on edge or stressed in some way.
Okay, good to know. Lots of fun stuff. The other fun thing that I think you mentioned yesterday, I think your watch tells you how much time you spend in what? REM?
Oh yeah,
sleep?
yeah. Deep sleep, REM sleep. Yeah. That's the other cool thing about it. It tells you about your sleep.
How much should you be getting of that deep, good sleep?
Well, ideally around an hour a night, and I'm telling you, I haven't been getting an hour. It's at least the watch is telling me that I'm getting, 40 minutes. I got an hour a few nights ago, but it's like an occasional thing and not every night thing. And then REM sleep, similar kind of thing. You should be getting a couple of hours, and I'm getting maybe an hour. So I don't know.
So when you get that kind of information, what do you think? What do you do to increase that?
So that's what I've been researching. What do you do to improve your sleep? Okay, so that's another reason why I started exercising again. I mean, I've been exercising, but I just started running, doing some cardio, so I can get steps in, burning calories, and all that.
Yeah.
Because a great way to increase your deep sleep is to use up all your energy, is to use up all the glucose and the stored glycogen, and so that's what I'm trying to do.
How about magnesium? Does magnesium play a role in that? Taking that at night, maybe to help sleep?
Yeah, magnesium does help your sleep, but I don't know if it changes the quality or
Okay.
the structure of your sleep, the REM versus deep
Sure.
sleep.
I often wonder too, how does melatonin affect that?
Yeah, I don't know how melatonin affects
Okay.
that either. I don't know.
Okay. All right. Let's quick review these one more time, and then we're going to dig into some questions, you guys. So just so you have this for your reference, if you're taking notes. So these are the common signs associated with a healthy heart. 1, a standard heart rate. 2, normal breathing. 3, good oral health. 4, normal blood pressure. 5, healthy cholesterol levels. 6, the ability to regain your regular heart rate after rigorous exercise. And 7, an active lifestyle. And that lifestyle shows that your heart is efficiently functioning, okay, and that your body is able to get adequate nutrients and oxygen. So those are our 7 common signs associated with a healthy heart. We're going to dig into some of your questions now. A couple questions here. Hello, Anku. He is wondering, Dr. Saunders, if you could talk a little bit more about mitochondria health and how we can make it work efficiently.
Okay. Mitochondria are the little bacteria that live in your cells, that make the energy for your cells. Without mitochondria, you wouldn't have any energy in the cell. There's no other way to get ATP into the cell, to actually have energy so that the cell can function and do stuff. So those little powerhouses are super important for cellular function. And that's what mitochondria are. So you really want to protect your mitochondria. This is the reason people age, or one good reason people age, is their mitochondria numbers in the cells decrease. And so if you have, some cells only have one mitochondrion, is the singular. Whereas heart cells have thousands of mitochondria in the cells. So there's way different amounts in different cells, and they die and they have to be replaced, and they're replaced according to the amount of stress that's put on them. So when you're exercising, when you're doing especially cardio exercising for about 20 minutes, or HIIT exercising, where you're reaching a maximum amount, or you're breathing hard enough to use up the glycogen stores, then your body starts taking out the injured, dead, and not working, the mitochondria that aren't working, and starts replacing them with new mitochondria. And the new ones are new. They're like babies. They're not like just a copy of the old one. They're like brand new babies, and they're really efficient and they're working well. And then they get old and they poop out, and they have to be taken out and new ones form. So Anku's question about mitochondria is really important, minding your mitochondria. So to be more efficient, there is like so much junk and so much information. Number one, probably most important thing is exercise. It's kind of like muscles. If you're not exercising, you're not going to build muscles. There's these websites that I've seen that say you can sit on the couch and build muscle. And I'm like, no. Well, and they're not talking about exercising with isometric exercises or something on the couch. They're talking about you can lay around and just take a pill and build muscle. No, that doesn't happen. You actually have to use the muscle in order to really build it. The same thing happens with mitochondria. If you're not using them, if you're not using energy, then you lose it. And so a lot of people come to me and they say, oh, I don't have any energy. I feel pooped out all day long. Well, your problem is you don't have any mitochondria. So what are you going to do? Well, you have to build mitochondria by exercising. Well, I can't exercise because I'm fatigued all the time. Oh, okay. So what I recommend is that people start small and just increase just minimally. You know, if someone the other day said, all I can do is make it to the mailbox and back. And I'm like, okay, do that 3 times a day to the mailbox and back. And then the next day, to go to the mailbox and go 1 step past the mailbox and then go back. And then 2 days later, go 2 steps past the mailbox and then go back. And just keep adding a step each day, just 1 step each day. And it'll, you know, within a year, you're going to be walking a mile. It'll be, it takes time to build, and it's okay to do it slowly. So exercise is number one. Number two is fasting periodically. You know, when you fast, that autophagy, where you're taking out all the bad cells and all the bad mitochondria, that's what happens when your stomach is empty. So having an empty stomach, the more you have an empty stomach, the better. Okay, so that's, and then the third is getting adequate nutrition. So there are nutrients that the mitochondria need to function. And one of them, Leslie already mentioned, that's magnesium. Magnesium is extremely important. Most of the enzymes in the mitochondria require magnesium to function. So this is not a minor thing. And it's a common deficiency too. So taking a supplement's not a bad idea. But eating nuts and seeds and whole grains and beans, peas, lentils, and dark green vegetables are a better way if you're going to get, because you get a lot more than just you get the B vitamins too. So magnesium, B vitamins, and then for the heart, we often recommend the 4 these CoQ10, L-carnitine, D-ribose, which is just a sugar that's found in some fruits and vegetables. And then the other one is, what am I missing? L-carnitine, D-ribose. Oh, magnesium. We already talked about it. So those 4 are very important and common deficiencies that inhibit the building of mitochondria. So having enough of those is really important.
Okay, good stuff. Our friend Eric is back, and he is asking what your thoughts are about the Mediterranean diet.
I think the Mediterranean diet's great, and there's nothing wrong with it. I don't think some I've had people that don't tolerate it because it has dairy stuff in it,
Mm.
um, most people tolerate it well. It's fine, and we attach a lot of importance to diet that is less important. If you're eating whole foods, then you pretty much are going to get the nutrients you need, unless there's a problem, like somebody with Crohn's disease, for example, somebody with celiac disease. If you have some kind of intestinal problem, you can't absorb food. That's going to be an issue. But otherwise, people will get what they need by eating whole foods, and the problem comes in mostly when we're eating processed foods.
Yeah, good stuff. I think, yeah, I hear a lot about the Mediterranean diet and people love it. Okay, another a Zoom user, it says, had 4 stents put in last year. Will that hinder my heart in years to come? Like, will the stents last for years, or will I have problems with my heart?
Um, Stents are a temporary solution to a long-term problem.
Mm.
So, yeah, the stents themselves work, but I had one patient. Gosh, he had a one stent put in, and then he was put on a statin, and then he had a second stent put in and had a higher dose of the statin, and a third stent put in and got a different statin, and then had a fourth stent put in, got a higher dose of statin, got a fifth stent put in, and then he came to see me. So he came to see me with 5 stents put in already, and and I said, okay, well, obviously that's not your problem. So let's start looking at what the problem is, and we found his problem, probably, but. So made some recommendations. I said, well, the statin isn't helpful because that's not your issue. And then your issue is inflammation. So he started working with the inflammation. And his cardiologist got really upset about that. And
Mm.
so he went back to his cardiologist. And so I don't know what happened to him in the long run. But the problem with stents is that they work for that one vessel that one time, but they don't deal with the underlying or the cause of why it's happening. And so the stents are good for really one thing, and that is it decreases chest pain. People do not live longer because they get stents. There's no evidence of that. It does decrease chest pain. So I had somebody that he got chest pain just walking to the mailbox. Another mailbox thing, because we live in a rural area where people have to walk out to their mailbox, and so he didn't want to have chest pain with just a short walk. So he went and had some stents put in spite of my advice, and he's fine, and he walks to the mailbox and he doesn't get chest pain anymore. So yeah, they work for that.
Okay. Kathy said that she says you have a YouTube talking about mixing lemon juice, cinnamon, and warm water. After half an hour, you're supposed to do something to release it, but I can't find what to do. Any ideas?
Cinnamon, lemon juice, and warm water, and something to release it. Goodness, I don't know.
Yeah, I don't know either. Sorry, Kathy.
Mm.
Yeah, I'm not sure. You could possibly send an email to support@bartonpublishing.com. They might know exactly what you're talking about. I just cannot think of it.
Is that the gallbladder cleanse where you drink the olive oil after the lemon juice? I don't know.
Sorry.
Yeah.
Okay. All right. Let me see. David says, if you have a normal metabolism, is there any reason to take vitamin injections instead of just pills?
If you have normal metabolism, the assumption is you're probably okay with vitamins, because vitamins are vital for life and they're vital for your metabolism, and they're required. So if your metabolism is normal, you probably don't need injections. And I used to do a lot of IV vitamin treatments. We had 20 people a day coming in for, drips, 500 cc's, 1,000 cc's of, vitamin supplements and stuff like that. But mostly that is to get a high dose of something for some reason. Like somebody that had a chronic viral illness, one of them with chronic Lyme disease, and they found that if they get the vitamin C once a week IV, then they were able to function, go to work. Whereas if they didn't, they'd be in bed. So, that was, it had a specific function, but even then it was a temporary kind of, it wasn't a permanent cure. So the IV vitamins might have a purpose. I often give people like shots of vitamin B12 because I don't know, it's kind of hard to get vitamin B12. It's a big molecule, it's not absorbed. They have creams for it, it doesn't really work. And so I give people shots of vitamin B12 just to see. So if someone has neuropathy, I give them a shot. And they go, and then they come back and say, wow, that really helped. My feeling came back. Then we usually do a series of shots. But the people that say, I don't know, it doesn't make a difference, then that's not their issue. There's a different issue.
Okay. Teresa said, if you have an occluded artery, how can you best reverse this and clean out the artery?
Good question. Okay. So arterial occlusion is clots, and the clots form because there's damage to the lining of the artery. So cleaning it out is the same thing as dissolving clots. So you can do clot dissolver. There's actually enzymes you can buy now, nattokinase and lumbrokinase, which actually dissolve clots. The other part is to make sure you have enough of the, to decrease inflammation and dissolve clots, you have enough omega-3 oils. So we talked about this last time, how important it is to have a really good omega-3 to omega-6 ratio. Optimal is somewhere 1-to-1 or even more omega-3 than 1-to-1 omega-3 to omega-6. So a lot of heart tests now will look at the omega-6 to omega-3 ratio. That's what that comes out. And they usually recommend that it be, 4 or 5, but actually 1 is better. Because that can dissolve clots and reverse the heart disease. The other thing is to find out why you have those clots in the first place. Because I've had people that just took niacin and their carotid arteries, the atherosclerosis in their carotid arteries completely resolved in 1 year of taking niacin supplements and not really changing her diet. So it depends on the reason it's there. So if you find out the reason it's there and you either dissolve the clot or you decrease inflammation or niacin, whatever.
Okay. Judy said, my son has a lot of kidney stones often. Is there anything he can do to prevent this?
Wow. Son. Okay. So is this a kid with kidney stones? So a child with kidney stones, there's an issue, and it could be a dietary issue, but not usually. Usually if it's a kid, that there's some metabolic derangement, it's called, or a inborn error of metabolism. And often it's found, what's that?
She just said he's 53.
Oh, 53. Okay, a kid with kidney stones. So my son, 53-year-old son, has kidney stones. Yeah. So so if there were never any kidney stones as a kid, and all of a sudden he comes up with kidney stones, then looking into why that is, because there's a metabolic problem, and it still could be an inborn error of metabolism. That's not out of the question. Looking at the oxalic acid, especially oxalate system. But very often it's diet. And so staying away from, or it's often a magnesium deficiency is a common thing with kidney stones. And there have been studies to show that just taking magnesium and doing nothing else, no change in diet or anything or any drugs, just taking magnesium decreases kidney stones. So that's one thing. Vitamin B2 is another one that's often helpful.
What is the other name? Oh no, that's B1. B1 has another name.
Thiamine.
Oh, it is.
Yeah, vitamin B2 is riboflavin.
Okay, never mind. I have no idea. Can't think of what it was that we talked about before. What's B3?
B3, niacin. That was the one we were talking about before. Niacin, niacinamide, nicotinamide. It's got a ton of names. Nicotinic acid,
Okay.
nicotinamide riboside. There's a whole bunch of names for niacin.
Very interesting. Okay, this is good. Oh, okay. Eric, yes, I do know that you're on both webinars. I do see you on there. So that's awesome. Thank you for being with us. I think that's all for our questions today. Wait, nope. Let me just see. Okay. Yes, that's it for us today. You guys, Dr. Saunders, thank you so much for being with us. And
You're welcome.
We're excited. We'll see you next week.
Okay, see you next week.
Bye-bye.
Bye.
So those of you still hanging out here, you can go to bartonwebinar.com. Again, that is the link to all things concerning these webisodes, new word that we're coining today. It's probably not a new word. It's probably out there, but you will find a link to our YouTube channel at bartonwebinar.com. The YouTube channel, I would highly suggest that you subscribe so that you get notified when we upload new videos. All of these are there. Our fixed blood sugar webinars are there. And then there are some other things too. You can also find some high intensity interval training workouts. You may find there are some videos from some of you who have experienced great success changing your lifestyle a little bit, or maybe using one of our solution kits. And so you guys can see all of those there. It's just a good place also to purchase products, or you can also use the code webinar25 and you'll save 25% on anything that you see. So just a great place to go. We have our list of top questions that are asked. So just kind of consider that your hub. And again, we are here twice a week. Register for those 2 webinars there. Those are free, and you'll get a reminder about the webinar a day before, and then also an hour before the webinar starts. So that is all for us today. We are so thankful that you guys are here. I hope you learned a lot. I know I did. And we will see you next week. Bye, guys.